Medical Dilemma.
Welcome back to Medical Dilemma. Before we start the discussion for the second segment, I'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center at Palanan, Makati, LifeQuestPhilippines.com. Check out their website for webinars and seminars, and of course their partner, ManilaWorkshops.com. Now, to start off our second segment, I'd like to ask Attorney Suguitan, do we have legislation that is similar to what they have in the U.S., something like a Dignity in Death Act?
Well, to be frank with you, there is a complete absence in the law when it comes to treating these matters. You know, the right to dignified death. What our constitution and our laws prohibit is, of course, mercy killing, the death penalty, etc. But with regards to patient, when a patient has a right to dignified death, whether that exists in our laws, the law is silent about that. Philippine laws.
So, in the absence of clear laws, what do we have in its place?
You mean like an alternative?
Yes. So
to
do we have something like a committee in every hospital that discusses issues about death and dying?
Yes, we have one.
Yes, Dr.
We have. It's mandatory under the law, no? Because the OH had sent memos about it that we should have a bioethics committee in each hospital, no matter how small or big it is.
So this is required.
Yes.
Okay.
And what is really the purpose of that? I think our guests can explain better because he's also the member of that bioethics of Makati Medical Center.
The hospital ethics committee, as Dr. Sanchez said, is mandated by the DOH. So it's just a couple of years ago that DOH had this memo to have all hospitals with an ethics committee. In Makati Med, it's been, I think, 2 decades already.
Way ahead.
Yes,
of
the
this
ethics.
mandate,
That's why Makati Med was asked by DOH to give some talks on how to form an ethics committee. But speaking from my experience in Makati Med, the hospital ethics committee is just advisory in nature, and it will not dictate on what the doctor or the family or the patient should do.
When you say advisory, Dr. Joseph, is it advisory to the physician, the attending physician, or advisory to
the family?
To the family.
And at the same time, the physician.
Okay,
to all the parties involved.
So when issues are brought to the ethics committee, their decision is not the final say when it comes to those situations.
Recommendatory lang.
Does it make policies regarding how to handle cases after reviewing past events?
Yes. It has policies on how the attending physician can seek consult to the ethics committee, and also if the family wants to seek consult. So,
and in these cases, such policies are binding. They're not just advisory.
No, the policy.
It would be discretionary, right, for the family if they want to present this case to the bioethics committee.
But I guess the dilemma there is when the attending physician makes a decision that the family does not agree with. That will usually be
sometimes that's the starting point. So the attending physician will ask the family, why don't we seek consult to the ethics committee?
Yes, because it's composed of a group of doctors.
Not just doctors, but
from
lawyers
even,
and
there might be a lawyer
from the whatever religion the patient is belong to.
Correct.
Okay, now since we're on the topic of death and dying and the ethical issues that surround it, maybe a good question to start with is, what is actually death? How do we define death? Father Jerry.
Well, I'm going to give you 3 kinds of definition about death. When it comes to the medical side, it is the cessation of cardiorespiratory function.
Yes, but we also recognize what we call brain death, no? It means you're still breathing, supposed to be, etc. But all your functions, brainstem functions, are no longer there, and you are considered as brain dead already. We have the Philippine criteria brain death.
In
already.
local parlance, they call that vegetable. Is that the same, Doctor?
Not really, but
Not really. As I've said,
Deeper than
there
that.
are different kinds of definition. What I've said is the medical side.
The medical
Okay.
side.
yes.
And
So
that
what are
already
the other
includes
sides?
what you call it brain death, no? And we have also the philosophical side, which we know, if you know philosophy, it is the separation of body and soul. When the soul separates from the body becomes lifeless because it has no more principle of life. The soul is the principle of life. It's the one that gives us what we are now. We can move, we can eat, we can touch, we can do this and do that, precisely because we have the principle of life. But a deeper and nobler definition of death, you go to the spiritual side. That death is only a rite of passage,
A rite of passage.
where you pass from earth, from the earthly to the heavenly.
Okay.
It is also an event in which it gives us a very beautiful message, in which case we leave this world in order to live in our eternal world. And it is also a great heritage, precisely because no matter what people say, that we try to avoid death, it is something that we have to welcome. Otherwise, if there is no death, this world will become very chaotic. Why? Because if there is no more death, and you are already 1,000 years old, you still do not die, what kind of person you are? You are still walking on the street, and you are all bones. You have been run over by a 6x6 truck. You are still alive.
Still alive.
That is why it is a great heritage, something that we have to welcome. But the earthly would always say, let us avoid death at all cost. So try to think about the different kinds of aspect when it comes to death and dying.
Father, but may I ask, when exactly does the soul leave the body? Is it the same as the physical death that we have?
Yes, because the physical death means that it has no more life. And the life that gives to the physical body is the soul. The soul is the principle of life. Without soul, you are dead. You are lifeless. You are not alive.
So
You cannot eat.
going back to medical practice, how would a doctor establish that a person is indeed dead?
As Father Manlangit here says, the cessation of heartbeat and respiration. That's the most common aspect of a medical death. So no more heartbeat, and the person is not anymore breathing.
Not breathing.
But this concept of brain death came in during the 60s. So
Right.
Because of the introduction of organ donation.
organ donation.
That's why we have to have a definition of brain death.
Yes.
So how did the practice of organ donation impact, this definition of death? Why had it become relevant?
Because if there's no concept of brain death, no, we cannot harvest the organs.
Okay.
Right.
So
Correct.
meaning,
Right.
I guess brain death comes after cessation of breathing and the pulse.
No, you still
Or
have.
does it
It's
come
the other way
before?
around.
It comes before.
Yes.
Oh.
Yes. Because if you're going to harvest dead organs, it's not good for
No longer
transplantation.
useful.
No more.
But there's also this thing as a cadaveric
Right.
harvest,
From a dead person.
From a
you
dead
get the
person.
organs. Yes.
meaning no more cardiac and respiration.
Yes.
I see. Now, that brings me to, although I'm not yet very clear on when do we say that the person is really dead, it brings me to the next question of resuscitation. When do we decide that we should resuscitate
What
an
is the
apparently,
procedure?
dead body?
When a patient is brought to the ER and apparently lifeless,
Yes.
no heartbeat,
heartbeat,
no
no breathing,
respiration,
yes.
that's when you do resuscitation. So you try to revive that person so that he will be breathing and maybe, have blood heartbeat. That's what you call basically a resuscitation.
So in the emergency room, there is no choice but to do resuscitation
Yes,
as
in
soon
the
as the
absence
patient
of
comes in.
yes, in the absence of any history from the patient that
Yes.
I do not want to be resuscitated because I'm dying of terminal cancer, for example, you have to do resuscitation.
yes.
You have to revive.
Okay.
But you see, we have
Father,
to go
or
try to
deeper
revive.
into it because DNR can either be considered extraordinary or ordinary. Ordinary, which means that you can do the resuscitation thinking that something better, or we can still revive the patient, which means that it is in the interest of the patient that you do the resuscitation. It's just like any other intervention for that matter. But it doesn't mean that because, well, he came there, it's lifeless or what, it can be resuscitated or what. We still have to ask whether or not the resuscitation is still beneficial to the patient. No need to resuscitation if you know that you're not going to have any hope of recovery for the patient. That becomes extraordinary. Or just in any other, for example, scenario, and extraordinary means should not be applied. First, when the situation has offered the whole thing as burdensome. First, the pain and the sufferings, that's too much. That becomes burdensome. That is extraordinary. When the effort is just too much, that no matter how you do it, you have been doing, nothing good comes out of it. Extraordinary. Third, the psychological aspect, in which sometimes even the families are already fighting with each other as to what kind of decision they have to make. They cannot do it and relationships are already broken. That becomes burdensome. And the fourth is affordability. When the financial constraint is there and there is no more money to pay, that becomes a burden. When all these burdens or any one of them is present in that particular situation, it becomes an extraordinary. Disproportionate for that matter.
Okay, but these factors are considered in non-emergency cases. But within the emergency room, you have no choice. You have
you have
Yeah, in
to
the absence of
resuscitate.
any.
But
yeah,
once
yeah.
there is some sort of stability in the condition of the, or maybe the scenario itself, then the factors that you discussed, Father Jerry, apply.
Yeah.
Right.
They will be given time. They will be given time to discuss among themselves, the family members, as to what to do, so that when there is again another arrest, then it's possible they will no longer resuscitate the patient.
So in other words, the do not resuscitate order or DNR order can originate from either the patient's next of kin or the
Patient.
attending physician.
No.
Well, in an
Originate from
emergency,
the-
if there is no advance directive.
Yes.
Yes.
The physician cannot say that let's not resuscitate. No. You
It's
have
not a
to
medical
resuscitate.
order.
Yes.
We do our best on the
But
positive
it's
side.
the doctor that writes the order of do not resuscitate on the patient's chart after consulting the family or if the patient has an advance directive.
Because this is when the right to refuse medication arises, which has been the subject of cases in the U.S. and has not been brought up to our Supreme Court here. A patient, if competent, can decide for himself or herself not to receive medication, and that will not be tantamount to assisting to suicide, which is defined under our revised penal code.
Yes.
Yeah.
Yes. The patient has a right to refuse treatment if that patient knows that it is futile. It will not be beneficial to him or her because his stage is irreversible.
But what if the procedure suggested by the doctor still can maybe recover or
Yes.
help improve the patient's condition? Can the patient refuse?
Yes, the patient has the right to refuse because
Yes.
you cannot do anything without the patient's consent.
That would be battery, assault and battery.
But if the doctor knows that the patient is not on his or her right mind by
Unconscious, for
refusing that,
example.
you don't have any choice but to choose life.
So how
And-
do you establish the competency of the patient in such a case?
Well, you know if they're under the influence of
Alcohol, or
alcohol
drugs.
or
huh?
drugs,
Right.
or they're unconscious. If they're unconscious, you have to revive because you don't know if even if there's an advance directive.
Yes. you're not sure what he really
Yes.
wants.
Take for example, let's say I'm suffering from cancer in early stages,
Yeah.
which means there's still ways to
Yes, there's
cure
still
it,
hope.
right?
Yeah, it's
But let's say
curable.
I decide I don't want to go through any of these procedures anymore. I just want to die naturally.
That's refusing treatment.
Yes, that's refusing treatment.
Yes, that's different from a right to die. That's refusing treatment because probably you have your reason that my family might go broke or my body cannot undergo that treatment, that chemotherapy or the surgery might kill me. You have the patient has his or her reasons. That's refusing treatment. That's not procuring
It's not
death.
procuring death.
Yes.
Not really yet.
I see.
Yeah.
What do you think of that kind of
Well, first of all,
decision on my part, for example?
first of all, you have the first duty to yourself. You always choose something that is beneficial to yourself. Seldom patients would refuse treatment. Seldom. Only or probably those who do not have any more passion to live. No more.
Yes.
It's part of his own autonomy.
Okay.
So, in that case, he owes it to himself
And I'm
to
not
do something.
committing any sin or
You are committing your sin against yourself
against myself.
because you are supposed to be obligated to yourself.
I see. Okay, well, thank you for that very nice discussion. We'll have to take a break for a moment and listen to a few reminders from our sponsors. Don't switch that channel. We'll be right back.
Many of our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Imagine it when you share something to a public, you find that experience and that experience so rich it could change other people. Okay?
Encouraging the generation.
Like, there are other